tick-borne related illness associated actually with a patient who get a tick bite or exposed to ticks, and that could be a wide variety of infections. The most common infection that we see here in around Alabama is Rocky Mountain spotted fever, for example. Rarely we see others like Ehrlichia and Lyme disease, and that can happen after a tick bite within a week to 10, 14 days in general.
Okay, gotcha. And so, what are some of the symptoms somebody may experience with some of these illnesses?
So it really depends on what kind, but for Rocky Mountain spotted fever, which is the most common, in general it will be fever, headache, rash, and that sometimes can progress further where they can get what we call sepsis-like syndrome, and they need to be admitted in the hospital. Others, no, they will develop this for a few days and they improve. Sometimes if you seek medical attention quickly, you actually can reduce these symptoms faster and prevent further complications as well.
Okay, and if somebody were bitten by a tick and they think that they have one of these illnesses, should they go to their general practitioner first, or should they go to the hospital, or where do you think people should go?
So if you get a tick bite, you better go to your regular doctor because they can manage these. In general, we advise if you get a tick bite, you should seek attention within 72 hours. We can talk about how to take care of the ticks and stuff, but it's very important to do it within 72 hours because you actually now can get an antibiotic, one dose, that can prevent some tick-related illnesses. And that's why it should be done within 72 hours.
Gotcha. And what else should people, I guess, be aware of? Is there anything else people should be aware of as it relates to getting these illnesses?
Prevention. So tick-related illness prevention is very important and essential. And the main thing with it, this is the season gonna be where you're gonna see tick-related illness or tick bite that extend up to September, October. So what we usually recommend, wearing long sleeves, wearing long pants. Usually we say more lighter color clothes. That will be helpful so you can see the tick because the ticks is more brown or black color so you can see it. And then the other prevention, you can use some insect repellents. What do you call it? DEET, D-E-E-T repellent. That usually recommend about 30% DEET that you spray on yourself that will reduce the tick bite. In addition, the moment you come back, you better examine yourself. If you're in an area, and that's usually wherever you go out where there's possibility of ticks, you examine yourself and see if there's any tick attached and try to take care removing that tick, as the whole tick, with a tweezer, for example, and you take it out completely, but take it as soon as possible because it can feed on you if it stays longer. Also, warm bath, shower after coming back, that help reduce as well these tick attachment and bite-related issues as well.
Gotcha. And if not treated properly, can tick bites, cause any long-term health issues?
So with the Rocky Mountain spotted fever, you can get complication of sepsis, and you get admitted to the hospital. It can affect your organ. For example, Lyme disease, it can have some effect as a long term depending on your response and reaction and seeking treatment. You can have a long-term effect. So the prevention will be much, much better than try to just get treatment. Now, of course, the treatment is effective. Is actually for all these tick-related infections is very effective, but you need to seek medical attention very quick. Do not wait if you think you have a tick-related illness.
Gotcha. And is there anything else that you want to add that I maybe didn't ask you about?
No, I think that's good.
Okay,
If they get it.
Thank you. I appreciate it.
Absolutely.
So first question is, what are tick-borne diseases?
Okay, so tick-borne diseases are diseases transmitted by ticks that are infected with bacteria, viruses, and parasites.
Gotcha. And so what should somebody do if they realize or think that they've been bitten by a tick?
Well, it kind of depends on. So, if you remove a tick promptly and don't have any symptoms, you usually sometimes you can just monitor it at home. you clean the area, keep an eye on your health, and make sure, like, hey, I'm not feeling ill. But let's say within a couple of weeks you start to kind of feel ill. That's when we tell people to kind of seek medical care. This depends on. So if you start to develop fever, rash, severe headaches, flu-like symptoms after a bite, and if you're unsure how long a tick was attached to your body, and there are definitely ticks in the area, and then definitely some common tick-borne diseases. We tell people to err on the side of caution, so go seek medical care because early treatment is so important to prevent some of these conditions and then some of those long-term symptoms if symptoms develop.
So how can people avoid being bitten by a tick?
So we always try to push the narrative that prevention is key. So to kind of lower your risk, especially if you're outdoors, we tell people to avoid woody or bushy areas where ticks live, or where they tend to live. Walking on trails, so we tell people to walk in the middle of the trails instead of veering off into the grassy areas. Using repellent is so important, especially repellent that has DEET in it on the exposed skin. And then treating clothes with perithum, that's so important. And then if you go somewhere, let's say you've been outdoors, you've been hiking and stuff like that, we tell people within 2 hours of making it back to their destination to do a thorough body check. Check your body, check your clothes for any ticks that might be attached to your clothes or to your body.
Gotcha. And so should people be wearing, I guess, like long sleeves and like pants when they're hiking and going out and doing stuff like that? Is that also a way to prevent it?
Yes, that definitely is. So if you're out hiking, most majority of the time we try to say, okay, wear appropriate clothes. So like wearing maybe boots when you're hiking, wear long pants if you're hiking, have your socks on, maybe tuck your pants within your socks, then type of thing. Like, it's hot in Alabama, so a person might not want to necessarily always wear long sleeve clothes. But in those instances where you're not necessarily wearing long sleeve shirts or anything, that's why the repellent is so important. And then also, like I said, going back to it, when you come back from a destination, always check your clothes and your body.
Gotcha. And what are some online sources that people can go to if they've been bitten by a tick or just to find out more information?
So we kind of tell people to go to our website. We actually have several resources on our website. So if they go to our website, the Alabama Tick website, it takes you and provides you with some general information about our tick-borne conditions. And from there, we actually have additional resources for healthcare providers and for individuals. Just want to know some more about like tick-borne conditions, or if they have been bitten, like when and how to seek care.
Gotcha. And one last question. I know that wasn't on here, but you said, if you start experiencing those symptoms to go seek, help from a medical professional. Should people be going to their general practitioner or should they be going to urgent care?
But I think it just depends on. I can't say yes or no to who to go, but if you have a healthcare provider, I would say going to your healthcare provider is a key thing to do because some of those symptoms that arises can include especially for some early symptoms would be fever, muscle aches, headaches, fatigue, and rash. So more general symptoms. And then later on, you might, if it's not treated properly, you could experience more severe symptoms, and those symptoms could be like acute respiratory or renal failure. It could be arthritis, it could be neurological illnesses. So I would say your general healthcare provider. But if you do not have one of those, you might have to go to the ER.
Gotcha, gotcha. And is there anything else that you want to add that I didn't ask you?
The only thing else I would add is that like we kind of really say that prevention is key. So you're really trying to educate the citizens of Alabama that hey, it's better to be cautious. When you're out and about, we know like especially now it's gonna be summer, everybody wants to go places, want to have fun, but always err on the side of caution. When you're out and you're involved in different things, make sure you're treating yourself properly as far as like having proper mosquito repellent and things like that. So we don't want you to have anything. We don't want you to catch anything. So it's better to always, err on the side of caution and treat yourself before you go out